Hi guys, I'm Kieran Campbell and I'm a registered dietitian and heart health advocate who loves teaching people about the prevention and treatment of cardiovascular disease. I'm here today with a quick public service announcement about sudden cardiac arrest, particularly in young athletes. I feel that as of late there's been an upsurge in the publicity that these horrifying, life-shattering circumstances have been getting. And just this weekend I was watching television and heard a story about a young male high school athlete. His name was Matthew Mangine Jr., and he was 16 years old. In 2020, he collapsed on the soccer field of his high school in Kentucky, surrounded by teammates, his coach, and his mother, who had to witness her son lying motionless and unable to breathe on his own. Matthew's story wasn't the first case of sudden cardiac arrest for a young athlete, and it won't be the last. Sudden cardiac arrest and sudden cardiac death in teen athletes are said to be rare occurrences, but according to the American Academy of Pediatrics, sudden cardiac arrest is the leading cause of death in young athletes in the United States, resulting in one death of a high school-aged child every 3 days. When it comes to cardiac arrest, every second counts. The American Heart Association recommends an AED be used within the first 3 minutes of a cardiac incident. What's important for us all to know is that there are things we can do to possibly help prevent and, most importantly, help save the life of someone if a cardiac event occurs. It's important to make sure kids pass their physicals every year and that family history is also being taken into account. Sports that could possibly cause blunt force to the chest could also affect electrical impulses in the heart, causing an arrest. It's important that all coaches and trainers be trained in CPR and AED use and have immediate access to an AED in an emergency situation. And athletes themselves should speak up when they aren't feeling well, instead of just walking it off, so to speak. Matthew Mangine Jr.'s story and many others didn't have a happy ending. And for some of these cases, the reasoning may have been because CPR and AED use was delayed. Know what to do in an emergency situation by getting CPR certified and learning how to use an AED. And make sure schools, coaches, and trainers have an emergency plan in place and also know these basic life-saving skills. Follow organizations like the American Heart Association, the Sudden Cardiac Arrest Foundation, Parent Heart Watch, the American Red Cross, or the National CPR Association to learn more and get certified. Thanks for listening, and happy American Heart Month.